More medications, less health. Something's broken. Traditional medicine manages symptoms, but true healing addresses root cause. I'm Josh Rimini, pharmacist turned healer. At Beyond the Pills, we merge ancient wisdom with modern day science to inspire you through stories of transformation, practical trainings, and holistic healing. Join me and other practitioners as we guide you towards vibrant health, body, mind, and spirit, and move beyond symptom management into true healing. Hello, everyone. Welcome to this episode of Beyond the Pills. I am Josh Rimini, the unpharmacist. And today's guest, I'm super excited about this, is Alex Martinez. He is the CEO and co-founder of Intrinsic Medicine. We're going to talk a lot about these things called HMOs today. So Alex is, like I said, the co-founder and CEO of Intrinsic Medicine. He is a patient, an entrepreneur, business advisor, and healthcare industry leader committed to transforming how the gut-brain immune axis disorders are diagnosed and treated. He's driven to lead positive change within the healthcare industry. He co-founded Intrinsic Medicine to leverage human milk biology in transforming diseases caused by immune and microbiome dysregulation. Things like Parkinson's, juvenile idiopathic arthritis. I love talking things idiopathic. We're going to drive into that one. IBS, IBD, autism, and other gut-brain disorders. So in addition to his work, Alex is working with emerging women and minority-led healthcare startups. I think that's really amazing. And this includes his role as a business advisor for women in pain management solutions with Encove Health, and serving as a limited partner and advisor to Coyote Ventures, which is a femtech venture focused on women's health. He's also a business advisor for Thrive Healthcare, a platform technology that turns common spaces into managed residential facilities into on-demand community health and wellness hubs. Oh, that's kind of interesting. And in a previous life and incarnation, Alex was a director of corporate development for Ionis Pharmaceuticals and an associate attorney at Wilson Sonsini. He received his doctorate at the University of Michigan Law School and his Bachelor of Arts at Health and Science Societies, a public health concentration from the University of Pennsylvania. Welcome, Alex.
Hi, Josh. Thanks for having me.
Man, that's amazing bio. So pharma guy turned lawyer guy turned intrinsic wellness guy. All right, we got a lot to talk about today.
Yeah.
So tell some people a little bit about who you are and what you're doing.
Okay. So, we have to go kind of way back here because I think that's, the bio is all the in-between part, but where I am today is really a function of kind of where I started, right? Mm. So at the end of the day, I'm a farm boy from rural Maryland whose first job was working with autistic kids. So first job other than, working with animals and raising things, growing things and taking care of ecosystems was working with children with special needs. And so, starting that at an early age really. So there's a couple things there. First and foremost, I kind of fell in love with the intelligence of nature at an early age. I recognized it. It was the most important early life teacher for me, is recognizing how there's so much collaboration in the natural world. And the aspect of husbandry, right? Of creating health and stability and sort of prosperity for all members of those communities, right? Through proper husbandry. And then, the second component externalized is working, foundationally at a formative age in a context where when I would tell people about like what I was doing, they say, "Oh, that must be so hard." And I was always perplexed because it felt so easy and fulfilling to me to do that and show up there and to be working with children with special needs, in particular children with autism who often had limited verbal capacities. And that really kind of shaped my desire. It was certainly an anchor point of what I wanted to do. Because when you work hands-on with a living being and you're able to create a positive benefit on a day-to-day basis, that's the most fulfilling thing in the world. And it keeps you anchored when then you say, how can I do this at scale? Because at the end of the day, my journey is just a matter of saying, wow, I love helping people. How do I do that at scale? How do I amplify what I'm doing?
That's I'm hearing the entrepreneurial part of you already, right? And so tell people a little bit about intrinsic medicine, this intrinsic wellness that you've created, because I think the backstory is going to come in.
Yeah,
because people, I love that. I didn't know where you were going with that, but I did totally. It makes so much sense because in this journey of life, and we'll talk about it, like your first freaking job already showed you who you were going to be when you are here, right? You didn't know it at the time, but you were here to serve that community, and it's gone full circle all the way up here. So tell people a little bit about your company and what this is, because we got to get into this thing called gut health and this whole paradigm shift of this West world versus where we're going with these functional approaches.
Exactly. And so, let's skip ahead. So what is intrinsic medicine doing? So what we are doing is, as I said, fell in love with the intelligence of nature. And so my primary experience in biotech at Ionis, I was developing something called antisense therapeutics. And so these are literally nucleic acid based therapeutics that could directly inhibit mRNA. So these are genetic medicines. And so that's what I had spent most of my time on. And it was really focused on like rare diseases where there's kind of one gene. Let's, change how that gene expresses a protein and see if we can impact a disease. And a lot of that, while there were some, there was in fact, I had a privilege of working on an amazing drug, which is the first drug approved for spinal muscular atrophy, where children don't produce a protein, and in the most severe cases, they don't live past age 2.
Yeah.
With the drug Spinraza that we worked on, you could give it to pre-symptomatic babies, and they would literally develop normally, and they'd be a normal toddler walking and thriving. So there was an opportunity to work on really kind of that cutting edge. But then we also realized at that same time point that while we were serving very small groups of people, the technology of that company, and then by extension, the technology that pharma industry as a whole was putting all of their R&D resources for, really only serve these tiny patient populations. And they left all of us idiopathic chronic disease patients with really stagnant therapeutic options with nothing.
Let's slow down on that, because I think there's some nuggets in that that people don't realize. Because one, pharma, because I'm a pharmacist and I've been in community pharmacy since I was 16. It was my first job, right? So I've seen everything in the pharma industry and people coming. And what we're talking about here is not is there's two focuses. Like, one is everything for everybody. And then the other one is hyper personalized down to this specific gene of a 0.0001% of the population drug. And what I heard from you was cure, these thing that cured this very unique, specific thing that can be extremely cost prohibitive in some cases, but moving from that perspective of pharma focusing on these hyper specific specialized things. And then it sounds to me like there was this aha moment for you.
Yeah.
Right. This aha of like what we're doing technologically, and the thought process of all this is becoming something that could be scalable and used in different philosophies. So talk a little bit about that, because when you said hyper, it really struck a chord with me. Like, going down that rabbit hole of this little that doesn't affect a ton of people, but is pretty successful, to opening that up.
Yeah. And so you always need a reference point. And so it provided me the reference point, because that was when I saw the structural components and the financial incentives and seeing how those were directing R&D. So it was not based on market needs and gaps. It was based on market opportunities and risk-adjusted net present value calculations. And with ultra rare diseases, you have a much lower research and development spend. You have expedited pathways to market. You have support extreme pricing. We're talking about drugs that cost over $500,000 a year, right?
Yeah.
And risk benefit, right? The drug can actually have very substantial side effects and still get approved, still be the first line therapy. And so
whoa.
Okay.
So you're telling me that pharma's not really designing medicines for the common good of healthcare and wellness. It's how fast can we do it? We don't really care if it's hurting us so much, and how much can we spend? How much can we charge for it? Is that what I just heard?
I'm saying that there is an equation that basically there is a financial tail that is wagging the research and development dog.
I just think it's important, because coming from your industry, the inside, people don't hear this stuff.
Yeah.
They don't hear, I'm not trying to like pinhole this or try to make sure people are like looking bad, but there's a specific agenda around this that's very business oriented.
Yeah. And that's what I want to say, because like a lot of the people that I work with and worked with, they woke up every day and they said, I'm doing good. I'm doing this for people in need, for patients in need. And so it's really just understanding the systemic framework that creates disparities, right? Because, and this is going back and saying, after, leaving the farm, working with children with autism, where did I go? I went to the University of Pennsylvania, right? I created my own major in health and societies, where I was able to focus on public health, but I was taking, healthcare management course, healthcare business courses in the Wharton School, the best business school in the country. I was doing health economics. I was understanding the system at every level. And so that's why it's understanding the systems and how they create disparities. And so, what my experience in pharma is we were disproportionately serving people because it worked well with essentially a financial algorithm, a corporate finance algorithm that was being, rewarded, on Wall Street. And the paradox of it is those rare diseases are called orphan diseases. You know this. But we created almost a large class of orphan in a different use of the term, abandoned, chronic diseases. Pharma R&D abandoned large chronic diseases that we all and our families were most likely to suffer from. And so I'm, sitting there, somebody who's been dealing with IBS, atopic dermatitis since I was a very, young child, and there are no good treatments for me. And working in a stressful environment, feeling those symptoms every day, having that impact my subjective experience. And I was saying, whoa. Who's going to help us? And, it was also, that aspect of saying kind of the leniency that comes with if you're developing for a severe, rare, fatal disease, the toxicities, the side effects associated with the modality get a lot more leniency. And I realized, hey, actually, that is the impediment, because that's the biggest thing that breaks that algorithm is the risk benefit for these larger chronic disorders is not there. These things can't get approved using the technologies that they have applied. And so I realized that the ultimate ethical arbitration, the ultimate ethical arbitrage opportunity is to find truly safe compounds. And then I looked at all of those chronic diseases and I said, wait a second, what do they have in common?
Mm-hmm.
It's immune dysregulation and dysbiosis. Okay, so now I have something to work with. Now I have something to search for. Safe and works through the immune system and the microbiome. Where do I find it?
So this is the good stuff here, because, I'm functional medicine certified as a pharmacist, and in the functional medicine world, the first and last thing they tell you is, when in doubt, treat the gut. And we talk about this because large percent of our immune response, a large percent of a lot of things that our body does autonomically is through gut regulation or microbiome, not just the gut, but all different areas. Right. And so, but I want to touch a little bit, because I don't know if everyone picked up on it, because I really feel strongly about when people have purpose and they do real good in the world, it's usually through their own transformation. So you talked about your own health issues and how you got through them, and then it compelled you to move and help others through that process, right? So talk to us a little bit about how you got your story. I want to know a little bit about your story before we dive into the microbiome a little bit.
Yeah. And I mean, part of it was when I made the decision to jump and that I wanted to be an entrepreneur. I wanted to be making my own decisions. So, I quit a very stable job. Everyone pretty much thought I was crazy for doing it. But it was really driven by having developed a strategy for my assessment, for my work as an insider, and realizing that there would be a different way. And I needed to have the freedom to create my own platform. And the paradox of doing that is, when I left and I stayed on as a consultant, helped them, launch a drug afterwards, I had my symptoms, my GI symptoms got so bad. I lost like 45 pounds. Basically, I was eating. Every time I ate, I would be like incapacitated on the floor with pain, and had a ton of bloating. And, the thought was that it's probably a peptic ulcer. Come on, you're like some stressed out corporate guy now starting a company, having your own consulting firm. And I went in and I got scanned, and actually a mass was found in my lower intestinal tract. And so, I go in for a peptic ulcer screening, and then a surgical oncologist walks in the door. And all of this while doing, very kind of career, making a career altering move where you're, usually hopefully you're going to be at your absolute best to bring everything to the table. And so I went through a really challenging patient journey. And the diagnostic tests, so they tried to sample the mass in my abdomen, were not able to get it. They were getting acellular, debris. They were not able to figure out like what it was. Is this a malignancy? Is this cancer? What is this? And meanwhile, the symptoms persisted, right? And just got kind of scary skinny. And all the while advancing, what now is intrinsic medicine. And eventually they had to do a laparoscopic diagnosis, which is they cut me open to figure out what it was. So, and as it turned out, it was an anatomical feature. It was actually a duplication cyst that had gone necrotic. So at some point when I was a baby, there was basically my GI tract duplicated. And so there's basically a dead end in it. And it had gone necrotic. And so about 1.5 feet of my bowel was just profoundly inflamed. So I was basically having reoccurring bowel impactions. And that's what was driving the pain. So, but they did approach it as a potential malignancy. So removed lymph nodes, blood vessels in the area, resected my bowel, shut me up, sewed me all up. And then, I was just kind of like on my own, right? My microbiome had been completely wiped out. I just had an extreme surgery. And, what I was, told to do after that was essentially like go on the worst Western diet you can imagine. Yeah. Right.
Which is what feels good, right?
It's literally like eat pancakes and like white bread, and after my system being completely flushed with a tremendous course of antibiotics, with bowel prep, and, first and foremost, it's such a humbling experience, right? When you're there, because I think one of the things that happens in pharma, and I think it happened especially in the rare disease context, is there's another, right? The rhetoric works in you because you're like, oh no, I'm helping this other, right? And so, when it's yourself and you have that lived experience and you're like, man, everything I'm getting sucks. And and I can actually read the labels and I'm like, oh, all right, I'm going to have to account for this. It's, I'm going to have to make up for this. Wow. I just took this course of antibiotics and I know about the microbiome. Oh my gosh. I'm at risk of, hopefully I don't get C. diff. Hopefully, how do I rebuild my microbiome? And, and I'm in a fortunate state where I literally have access to my compounds and I use them to rebuild my microbiome. So I'll kind of pause there because that's
it's a great story. And thank you for sharing and being vulnerable with that, because it is a hero's journey and you experienced the healthcare system as the patient too, right? You see how flawed it is, even when they're at this high level, because we got to deep dive on the microbiome, because what this functional approach to health and things rooted around the gut health and microbiome and immune support and inflammation and immune function, is none of that is talked about in the West world's medicine. It's cut, snip, eat what you want. It doesn't matter what your microbes are, but that's 90% of our body. So we got to figure out all right, so let's jump ahead a little bit, because you did have those resources. You were involved in, and you were you were a very informed patient advocate for yourself. But let's talk a little bit about gut health and and the microbiome and its impact on the immune system, because a lot of people that listen and are going to be listening to this, it's relatively new for them. Like telling people that 70 to 80% of your immune function is not your immune function, it's the gut.
Yep. Yeah. So I think it's great, because like that's a great transition, because, the big learning here, as after that surgery, my IBS didn't improve. Yeah, I wasn't having crippling, recurring bowel impactions, but my IBS didn't improve. And so,
or for people that don't know, it's inflammatory bowel, right? So we're highly inflamed.
Yes. And the IBS I'm talking about, so I actually kind of had both, which is an inflammatory bowel disease, but also an irritable bowel syndrome as well.
Yep.
Which you kind of feel on a day-to-day basis in terms of your bowel movements, bloating, abdominal pain. And so what's fascinating about the gut microbiome is like when you actually think about it is like, I like to say that the gut and the gut microbiome is what allowed us to develop as a higher organism. Because if you think about that primordial soup, those early colonies of cells that said, hey, man, it's pretty brutal out here. What if we work together, right? They became multicellular. They formed tube-like structures. And then there were some other bacteria that said, hey, we don't want to formally join on, but we want to be your allies. We'll work with you. And what is that? That's the early symbiotes, the early microbiome. What does that structure look like? It's a worm. And what is our GI tract? If you removed it from our anatomy, you have a segmented worm. That is our, mouth to anus. You have a segmented worm. That is our GI tract. And so the provocative argument I want to make is that what we hear of as the second brain, the enteric nervous system, the gut nervous system, I think that predated the central nervous system. And so somehow this system is what directed the course of evolution of us evolving.
It's worth speaking about here, because we don't associate the microbiome, which are I'm pharmacist in me says, like, how can I speak at a third grade level to everybody? But like the critters in our body, in our gut, if we did, it is complete. You said it's symbiotic. And in the very beginning of our conversation, you said collaborative. We collaborate with all of these critters, and they're the ones that create the signals that jump all the things that happen in our autonomic nervous system, which is stress, fight, flight, immune response. All these things is we interact, but they're the ones interacting with us. We're not interacting with them. And there's way more of them than there are cells of our body in us. If we didn't have, people think that it's just good for gut health and your digestion. And I don't really, because in the functional world, not even in the Western, like allopathic medicine does not touch on this, but it's imperative for life that this colony of things that's going on with us, it is literally a symphony with our system. The gut, you talked about it. We got to talk about the gut-brain axis, the heart-brain axis. These are living communication, like it's like the internet for us, right? It's talking about how all of this is in line, and when it's out of line is the root cause of all these downstream effects of what you're saying is the chronic diseases, what you're treating, what you're using, and this massive impact that you have on the world right now is about chronic disease. And we got to talk about why chronic disease is on the rise. We're the richest country in the world with the most medicines and the most spend, yet autoimmune and chronic diseases are skyrocketing. We talked about the autism. It's at astronomically higher instances now. So our bodies, our environments, everything is more toxic, which is causing all this downregulation and downstream effects of all these things. I just wanted to pause, and hopefully everyone, if they didn't get anything out of this talk, the one thing they get is gut health is number one, period.
Yeah, I strongly concur with that. I think, Hippocrates said it. All disease starts in the gut thousands of years ago. I've examined a lot of sort of ancient medical texts, and I mean, the ancient Chinese were doing microbiome therapeutics thousands of years ago. They knew this, and as a way to kind of both simplify and empower people, it's like, think about the gut microbiome. It's a sixth sense. Like, we think about like our five senses, but think of this community as an environmental sensing organ rather. So thinking about the gut microbiome as sensing the external environment, but sending very specific signals to all areas of our body with high resolution on how it should interface with that environment. And so what am I talking about here? Where are you taking something from the outside and putting it inside yourself multiple times a day? It's eating.
Or breathing, or drinking, right?
Breathing, drinking, but just ingestion. But when you're taking a large mass of something foreign, absolutely foreign, of indeterminate amount, right? We know generally what air is composed of, what water is composed of. Those are kind of limited consortia of intakes. But think about how diverse, how random you're taking something from the outside, and also what a risk that is to a system as well, right? It's like there could be outside pathogens or bacteria on that. There can be toxins, right? And there could be allergens in that. And who's the first recipient of it? It's not the body, it's the symbiotes. And so it's their discernment of what's going on there. And then they're sending messages to all of their allies.
Yep. And it's not if there's toxins, it's they are toxins. We're living in such a...
Yeah.
We ingest more chemicals in a month that our grandparents ingested in a lifetime.
Yeah.
So we have this and we're not any genetically different. And I love what you said about like this ancient, because this is the premise of my podcast, is like ancient wisdom meets modern science. Mm-hmm. So this modern science is catching up to what they already knew thousands of years ago, but we're putting our Western brain around it and talking about these things in such a different way now, because these critters are directly affecting and integrating and communicating straight down to the genetic codes of what we do. Mm-hmm. So it's not that we're doing it, it's that they're doing it. And it's really who's the parasite here, right? Who's the I always talk about that with people is like, who's actually in control here, right? It's literally the little guys.
Yeah.
They're orchestrating the whole thing in this body. It's almost like they were like little puppeteers,
Yeah. And just to, take a quick detour into some mysticism here. Think about all ancient meditative practices. What's preparatory for them? It's fasting. So what do you get with fasting? What you get is you get a quiescence of the microbiome. It stops sending signals. That's when you get to be alone. You go into a prolonged fasted state. You don't need external energy consumption. The microbiome is quiet. And
which makes the brain quiet.
Which means the brain is quiet.
Yeah.
The somatic cells are quiet. That is when you can truly know your genetic self, right? Where you're really only getting those somatic messages when you don't have the noise of the microbiome.
Yes, yes, and yes. Like these are like the 3-day water fasts. Like when people, that's when people get to that. That's when I'm in an energy medicine certification class. And we talk about like Vision Quest. And the first thing you do is you fast for 3 days. And then you go on this quest to understand, because that's what calms the brain down. Because the gut brain is now in harmony. It's slowed it down. The opposite effect of that, when people are hangry or they're craving sugar, it's not the brain craving, it's the candida talking, right? It's the overgrowth of the pathogenic bacteria and yeast that's causing the brain signals, because they're not getting fed. Right. So that's why the sugar cravings and the carb cravings come, because it's literally the bacteria communicating, firing up those signals, which is causing that emotional charge for people to get cravings and totally hangry. Mm-hmm. So it's interesting. It's not. And then that's how you know they have a candida overgrowth. You don't even have to test them. It's like, Joe, did you get sugar cravings and you get really nasty because then you don't have it? And they're like, yes. I'm like, all right, let's start treating candida.
Wow. I never knew that. That's news to me. That's
well, it's the metabolites, right? They're getting starved.
Yeah.
So that's exactly the gut brain connection in the wrong direction.
Yeah. That's fascinating about candida. That makes complete sense. It's right. It's an elegant system, right? And but it is kind of like an opportunity, it's like, first know thyself, right? And so this is a really key component of it. And as you say, it's like, know where the contribution to behavior is coming from, self, non-self. And that's why, to my earlier, kind of point about, the worm became before the spine, before the brain. Okay, so why did it allow those things? Why did this exoskeleton develop? And it's because of greater feeding and foraging opportunities.
Survival, right?
Yeah, but to enhance opportunity, sure. So. Another takeaway I think for listeners is, cultivate the awareness and just figure out like how your feeding behavior drives your life, right? And then you can think about, just to give a sense of how much the microbiome, plays into your everyday routine. And then it creates an opportunity to modify it as well.
Well, and it's important because we've talked a lot about the microbiome in interesting ways here, because it does rule the roost here because of that downstream effects, these signalings. I always say like food isn't just energy; it's information.
Yes,
and it's medicine. Food is medicine, but it's also a poison depending on what you're eating. And so let's talk a little bit about, maybe this is a good time to start talking oligosaccharides.
Yeah.
I know them from the functional world of fructooligosaccharides because we use them all the time in gut health, because prebiotic fiber is really good in food for the critters that are good for you and that increase all that signaling, which allows the body at this time signal itself and do the good healing, right?
Yes.
So I'm just getting used to this stuff coming from human milk, but let's talk a little bit about this, because this is the modern science part of this, which is also part of the ancient wisdom, right?
Yeah.
So let's talk a little bit about it.
Yeah, absolutely.
This is your passion space. I want to hear you. I want to hear
that. Yeah, this is. And, you know, in the vein of what we forgot, it's like we're the only, you know, civilization on record that didn't use human milk as medicine, right? In fact, we, almost removed it from babies for generations, right? Via formula. And so, you know, as you're talking about these plant-based prebiotic fibers, as instrumental for gut health, you know, what may be surprising to listeners is, guess what? Humans produce prebiotic fiber. Wait, what? That's odd. We're not a plant. Well, turns out that mothers, when we look at human milk, after fat and lactose, which are both caloric elements of milk, the third largest solid component of human milk at 5 to 15 grams per liter are prebiotics called human milk oligosaccharides. And there's about 200 distinct structures of them. And these compounds are non-caloric. Our body can literally not break these things down for energy. So what are they doing?
Exactly. That was my first question. So what are they doing?
And I love how you said that, food is information. So these are, it's a communication system by which a mother can speak directly to the baby's developing microbiome, which ideally she collinated with hopefully a vaginal birth, right? Which is, we can talk about that when we talk about increasing rates of autoimmune diseases, autism, things like that. Sure. That's usually where the foundational inoculation of bacteria that the mom had gets seeded to the baby. And how do you keep them there? How do you make sure they flourish and that the pathogens don't outgrow it? The mom has a unique combination of this delivered through breast milk to cultivate and nurture that foundational ecosystem. But you have to remember that, the baby's immune system, in some ways, what does it look like? It looks like somebody with autoimmune disease. It's an immature system. It doesn't know who's a good guy, who's an enemy, how to deal an appropriate.
It hasn't been developed yet.
Exactly. It hasn't been developed yet.
People don't realize this. There's an innate immune system and then there's a learned immune system, right? And so part of the learned immune system is getting a bug and getting over it and figuring it out. But there's this innate system that's pretty much sterile, right? There's no gut flora in a baby until you go through the birth canal, which is super important.
Yeah.
And then the mom, this is evolutionary things, right? What's the most nutritious and healthiest food on the entire planet for a baby? It's breast milk, right? Human milk that comes. And they've done so many studies to show if you drink the breast milk and you go all, even in the old tribes, how old are the kids still drinking breast milk? Yep. They're 5, 6, 7, 10 years old. Mm-hmm. So breastfed babies and natural birth babies we already know the science is pure. It's like they're so much healthier. Their immune system develops. So what you're talking about here is taking the benefits of human milk and bringing it to the medical world. I wanted to I wanted to make sure people understood. My wife was religious about making sure both of our children were breastfed for at least 1 year, and it just opened up their immune systems. They're and we're organic and all that stuff, but feed mom good stuff. She feeds baby really good stuff. And my kids they've had one sick visit their entire lives at the doctor. And I'm firmly no. It's the first question we ask in functional medicine. Were you breastfed?
Yep.
Were you given antibiotics? Those two things happen to do with how the gut develops and the immune system develops. So continue, because this is your field. I just wanted to make sure we didn't jump to where you are without showing people there's a massive amount of importance here from the standpoint of this beautiful, natural, super nutritious food, if you will.
Yeah. And, maybe to modify that, it's not just a food. It's taking food as medicine, right?
Yes.
So if we look at human milk, there's calories, there's nutritional components. There is a whole host of cutting edge medicine in human milk. There are antibodies, there are exosomes, there's there's even RNAs in there. Mm-hmm. And then you have, again, the largest component, human milk oligosaccharides, non-caloric. And what these things do is they don't just feed. Let me walk through stepwise all the functions that we've identified for these. So they do preferentially feed bifidobacterium, which is probably one of our most important bacterial allies. That bifidobacterium can metabolize these and cross feed. Right, think about them as a keystone species in the ecosystem, cross feeding a bunch of other commensal microbes. These sugars, and so I'll use the term interchangeably because an oligosaccharide is a fancy way of saying sugar, also serve as soluble receptor decoys for pathogens. And so sugars that line our mucosal tract and things like that, that's actually how sometimes pathogens enter the human body. And so some of these the HMOs, pathogens bind to them instead of being able to bind and find entryway into our body and pass out that way. And so that's another mechanism of essentially how the human milk oligosaccharides can kind of terraform and set that foundational microbiome. But beyond that, as a prebiotic, as I mentioned, they're being metabolized into a whole host of other substances, short-chain fatty acids, butyrate, which is so important for the health of the cells in our colon and our intestine. It's literally what they live off of. It's a preferential food of them. So it's literally feeding our body's own cells. And they're also producing with precision a bunch of drug-like small molecules that enter the body and even get through the blood and enter the brain. So signals that start early, that start telling the body, hey, you're in a good spot. This is what to do. And then one of the things that, especially coming from your background with the fructose oligosaccharides makes, I think, HMOs special is they have microbiome independent effects. And so these are effects that don't rely on the bacteria. These, as I said, these are our communication. This is some sort of language. They can talk directly to the innate immune system as well as the adaptive immune system. And so what we've seen with these compounds is they can take, for example, macrophage, the key cell in the innate immune system, and take it from that M1 phenotype where it's, search and destroy, to M2, rebuild, regenerate. And so what we've seen is that HMOs are able to create balanced immune responses, both on the innate system and also expanding Tregs. So the T regulatory cells that kind of orchestrate and manage the adaptive immune response. And that's why we can see effects on both autoimmunity, but also things like allergen immunity as well. That's a lot.
Yeah, it's big because so what I'm hearing, because there's the simplification to me is like, all right, it's got good effects in different places, and it's adaptive, right? We have this modulation of the immune system. So where let's call them drugs would turn on or off something, it's almost like a light switch. And these are like dimmers, right? They're dimmer switches because they're balancing. So when something's off, it goes back to harmony and balance. So this homeostasis is happening. This hormesis is happening.
Yep.
And it's also influential to the bad guys not doing what they're supposed to do. So it's got this dual effect or triple effect, I heard, like around that space. So obviously we can't go around milking moms with milk and grabbing all this good stuff and going. So we know it's good for us. It's the superfood. We know it's more than food. It's got all these factors going in there. These oligosaccharides, these things are beautiful messenger systems for the right stuff, all the good things going in the right direction. So tell us a little bit about how it works. How do we, like, where this is where the genesis of this company came from, I assume, right?
Yeah. And so, yeah, you really set me up nicely there. Because, like, you know, really the capping point is these compounds program the human system for balance, for homeostasis. That's
what they do with an infant, right?
Yeah, exactly.
They're taking the most beautiful thing you could do for a baby and set it up for success in life. Yeah. And you've brought it back into the world. So that, to me, that's mind-blowingly awesome.
Yeah. That's the thing is, like, I'm not some, like, oh, wow, I invented this thing. Instead, it's like, I see the world through pattern recognition. I saw a beautiful pattern in nature, and I just wanted to ask a simple question, which is, hey, if these can determine an infant's lifelong health, could they also be a reset switch when we're older and in a state of dishealth and disharmony? And so, also, your other point is very important. Mother's milk is for babies, including donation milk. It should not be diverted for pharmaceutical adult applications. Knowing full well the importance of breast milk, my wife did have, issues with mastitis and food allergies. And so we use donation milk, and what a blessing it is to have had access to that. And again, incredibly important. So don't want any moms to beat themselves up. If you had troubles, like that is a systemic failure, and we're trying to remedy this. Okay. Because what I'm doing here is I'm actually leveraging, manufacturing technology that was developed to make infant formula closer to breast milk by adding human identical milk oligosaccharides to it. And these can be produced using bacteria in fermentation. You can brew human milk oligosaccharides, and then you can, of course, purify them and make them available. And that's important, is now there are formulas with human milk oligosaccharides in them that do offer improved, effects on a baby's developing system. And so we're able to leverage that type of manufacturing technology, to develop these at large scale, where then we can produce them in quantities. I mean, just a few years ago, it would have cost hundreds of thousands of dollars to produce and isolate some of these per gram. And today we can do it at a cost-effective, for research and development purposes, where we can contemplate dosing adult patients, at 10 grams a day for 6 months. And so that's really the premise of what we're doing. Yeah. We looked at these compounds, and I said, these are nature's drugs. I took them to the FDA and I said, hey, are you seeing what we're seeing? And they said, yeah, these are nature's drugs. We consider them drugs when used for these therapeutic applications. And then we used our background in pharma to develop, to look at the scientific landscape and say, no one's really done that gold standard, placebo-controlled randomized study with these compounds in the best indication. And when we looked for, what a prototypic, gut-driven adult disorder would be that matched the profile of the single HMO that we have most scaled to date, turned out to be Parkinson's disease.
Wow. So let's talk a little bit about these things now. So you've isolated them down into these specific compounds. You're able to get it manufactured and cultivated in a way that you can actually get the right doses. And what I love about this is human milk, it's super bioavailable because the baby's eating it orally, right?
Yeah, exactly. Yeah.
Which is, again, don't mess with nature. Like nature has evolved this. So you got this bioavailable, which is absorbable through an oral mechanism, and you've been able to isolate. But how did you get from, all right, this one does this, or, that's got to be, to me, that's like super confusing.
Yeah, so it came when first, like the individual structures, because this has been known for 100 years. It used to be called the bifidus factor.
Yeah. Really?
Yeah, it was called the it's like an old timey medical term. Oh, the bifidus factor in human milk, and that was before they could really discern what these things were, because they're hard to see because they all have the same kind of molecular weight. And they're all made out of the same building blocks. They just differ based on, the bonds, the angles of the bonds. And so it really wasn't until we had mass spectrometry, really advanced technologies, that we're able to even see what these distinct structures are. And then from there, you say, hey, for example, 2FL is the primary one. You're like, that's 30% of these things. That thing must be pretty darn important. Now that we can produce it, let's put it into different models of disease, different contexts, and see what happens. And that was kind of like the exploratory state. And, it was really recognized that 2FL is the primary, really instrumental in developing the gut, maturing the gut, feeding that foundational microbiome. But there's another fascinating aspect here is that, 1 to 4% of these with oral administration enter the bloodstream intact. They're doing something in there. And to add further intrigue, and this is how I originally recognized that, wait, this is not nutritional. These are drugs. HMOs actually are in the fetal cord blood. So they're circulating in the baby the entire time it's in utero, and they're surrounding it in the amniotic fluid. These things don't happen by accident. And even more strikingly, HMOs appear in maternal circulation in the first trimester. They're conferring a benefit to the mother systemically. They're protecting the moms. And so when you see a compound and you say, wait, this is inside, surrounding, and then externalized, being produced, for, ancestrally years of oral consumption, and then a proportion is still reaching systemic absorption, you say, wow, this is really important. And so let's systematically characterize these and figure out what the use case is. And that's a beautiful aspect of what I'm doing, which is it appends the pharmaceutical development model. Is I just look at nature and I say, these are important. Now we just have to find what they're for versus me coming up with something and saying right. Hey, let me try to hammer this into, this square peg into the round hole. Right.
Yeah. Well, don't mess with nature, right? Because nature is so I love it. It goes full circle into your intuitive thought process or your intuitive knowledge when you were younger about just your relationship with nature, right? And this is another thing. It's why would we be bathed in this stuff and not have it be important, right? So, and then looking at it from the perspective of, all right, if this is the most of this stuff, like that's the predominant one, and I think it's interesting they called it like the bifido factor, because that's the most predominant strain that's doing the most anyway, right? From a bacterial perspective, bifido cultures are awesome. And so tell us where this technology is going, and like, like you said, Parkinson's, but like I sense and feel like this is a breakthrough in ways and manners in which people are going about these kind of health concerns. We talked about the root cause with the gut and how it's a downstream effect to these immune responses, and how we've also talked about how these beneficial immune things are happening when you're doing it from an infant perspective at birth. But now we're talking about almost turning back in reversal of conditions that have been like the hyper or the immune response issues. So now this is coming around full circle with your company, what you're doing. Are these drugs? Are you going through FDA? Are you going to get specific indications? Or are we looking at it from some other, like you said, scalable component here?
Yeah, and what's important to me is making sure people have access to these. The first step is informing people about it, and that's the other thing is I don't want one of the challenges when you're developing pharmaceuticals is that you're like, hey, I have something amazing. Check back in 7 years. Right? Or yeah. That we
don't even know it's amazing. And then it's 7 to 10 years.
Yeah. And so like, that's, a challenge here. And that's where, I have to address several priorities. First and foremost, it's a lot of great groups have gone out there, elucidated, help show what these things do. But no one's really done, as I mentioned, that gold standards trial, the type of thing that can go into the high impact scientific literature that will reshape thinking of how we treat diseases to show that you can intervene in them. So, right, when we look at like right now, it is an absolute tidal wave saying the microbiome is deterministic and probably the most easily modifiable aspect of different diseases. Like now rheumatoid arthritis has a gut microbiome, drive, like in the highest impact publications. And so people are like, what can we do from here? A lot of people have heard about like fecal microbiota transplants and how those work, but they're just inherently not scalable. There's some dangers associated with them. There's an ick factor. And, even some transplants, like it's literally changed them. Wow, it addressed that disease, but they became obese as a result from having the transfer of an obese person. It actually shows
kind of like an organ transplant, right? You're getting it from a other person. Some people that don't know what a fecal transplant is, basically you're swallowing someone else's fecal matter and you're recolonizing the gut in hopes that the recolonization is going to give more of the beneficial stuff. And so now you're kind of hyper focusing on not the broad stroke pen here, but really getting down into predictable, scalable, and sustainable, really, effects. Because, I know that it's kind of like an organ transplant, a heart transplant could go good or bad. The immune system could go change. So this is kind of that same space. So I just want to make sure, because some people will be like, what the hell's a fecal transplant?
Yeah. And I think that's a great way to put it. It's literally like a major organ transplant. And so you only do those for last resort.
Yeah.
And so really there's been a gap. A bunch of other, companies have gone out there and I'd say taken a reductionist approach to it. They said, hey, what components of that, fecal microbiota transplant led to the beneficial effects? Because they do work on a whole range of diseases. And they said, okay, let's take maybe a limited consortium of those bacteria, or let's take some of the metabolites that are in there. And so you're kind of deconstructing the thing and really diminishing the benefit. But our vision is, hey, you know what would be amazing? Instead of eating someone else's poop, it's making yours look like the donor's. What if you shifted your microbiome to look like the donor that would address your solution? Wouldn't that change your health status with none of the risks, all of the benefits? How do you
signaling the body to do what it was supposed to do?
Yeah, and how do you go upstream of that system? It's prebiotics.
Right.
And what's the best prebiotic on the planet? It's the one that foundationally programmed us all, the human milk oligosaccharides. And so it's taking all of that and then saying, okay, we have to meet the scientific community where it is and deliver the standard of evidence that will lead to practice change. And that's why we're going down the pharmaceutical path. And then in parallel, though, the public health perspective says, wait a second, these compounds are available to be in infant formula today. Is there another access channel where we're not holding them out for therapeutic uses, where people can access them? And that's something that's in the works. And if people are interested in that, I, suggest that they, go to my website, Intrinsic Medicine, just sign out the contact form. Tell me who you are and what your gut related issues are. And then you'll be on our list so that when I have announcements, whether it be for a clinical study for a specific disease, you can hear about that, or when perhaps another access channel is announced, that then you're first to know.
That's amazing, because that was my first question. Because when the pharmacist brain in me says we're going down the pharma channel, I'm like, well, that's going to be a lot of money, a lot of time, and a limited access. So I'm like glad that you're looking at it from that perspective, almost like a medical food, right? That's kind of what we're talking about. That's amazing. So what do you see the future for this? Like, what is in the pipe? So can you tell people like what benefits you're seeing in different types of, cause I would imagine people hearing this is like, this is all great, but is it good for X, Y, or Z, or what are we seeing in, if we're talking a year from now, where is this thing?
Yeah. So in a year from now, this will be in a phase of clinical studies in Parkinson's disease. And this is, I think, really important. It's now just widely recognized that idiopathic Parkinson's disease is a microbiome driven, both oral as well as gut microbiome driven. 80% of people with Parkinson's have constipation, and that's usually like the preceding symptom they have. So we'll have clinical studies well underway there. We're also developing for inflammatory bowel disease. There's an ongoing study of our compound at Cincinnati Children's Hospitals in pediatric patients with IBD. We're also exploring allograft versus host disease. There's been a positive phase 2 study also done at Cincinnati Children's Hospital with that compound. And then we'll be planning on also initiating our own Crohn's disease, which is one of the forms of inflammatory bowel disease.
Yeah.
And then the other key programs that are going to be like follow up are going to be in autism, right? Because, GI is one of the primary comorbidities of autism. 50 to 80% of the kids have either constipation or chronic constipation or diarrhea. And so there's an opportunity to treat them there. And then we also have 2 additional distinct oligosaccharides that also, based on preclinical data, look like they're going to have some immune and neurological benefits on things like irritability associated with autism. And so yeah, so
those are pioneering spaces, because all the things you're talking about in the normal, let's just call it the normal, but the traditional medicine model, there's no treatment for this. Like, and not even like we're barely touching the the surface on just symptom resolution, because that's really what medicine is doing.
Yeah.
We're not really getting to the root cause. So, and it's just, to me, it sounds like we're at the cutting edge of this and we're moving it in this direction. And it's kind of like with when you see results in one place, it's almost like the mycelium of mushrooms. It just starts to grow out, like that culture grows out, because we're at the root cause here, which means if we're using it, you're gonna see the side effect of it helping here, of it being, the do no harm approach, because it's working on the body that's triggering the things that are all healthy, just like nature did in the beginning of your life. And so I see this being a massively cool and fun thing. I can't wait to just continue to just follow this now, because it's just something that's exciting. It's like bringing in something that's so, when things work when you solved a problem that made sense from the beginning, right? Because that's what you said. Like in the beginning, it's like, why can't we just use human milk derivatives that we already know are super beneficial?
Yeah.
It's like, yeah, I love it. I love what you're doing. So intrinsicmedicine.com, is that where people can go?
Yep.
They can get more information. They can get on your list. I love that we're doing studies, but we're also seeing how we might be able to have some inroads to some functional doctors and getting people that are really, really understand working on the gut, right?
Yeah, exactly.
It's not like bringing it to the gastroenterologist who barely even says probiotics are good for you. Mm-hmm. So I want to make sure that people know where to get you if they have questions. And also this is it's cutting edge, but at the same time, I love this, because this is like the segue of this whole podcast is ancient wisdom meets modern science.
Yeah.
And it's like, boom, this is just one of those reasons why we were supposed to meet and supposed to have this conversation, because this is, to me, this is where true medicine is. Yeah. You're talking healing.
Healing, exactly.
You're not talking curing, you're talking healing. There's a big difference between cures and healing. And when you teach the body to heal itself through the right signals, and what can people do today? Treat your gut right? We don't need to go to these invasive procedures. If you can change the microbiome in your gut in one day, just by the food you eat. Yep. So we need to make sure people are also doing the things they can do, reducing your stress, eating the right foods, getting the good prebiotics and probiotics coming from the fibers that we're eating. I love this, because it's like, when in doubt, treat the gut and treat the gut right. And making sure we know now through this podcast and through other means, the gut is so important, so important. If it's kind of like with Wellness Made Simple, people are like, what's the supplement I could use for the blank, blank, and blank? And it's like, are you optimized on omega-3? Are you optimized on magnesium? Are you optimized on these simple things? Have you done the simple first?
Yeah.
If people are looking for the complicated because of technology and all these other things, it's like, no, let's teach them, lower your stress levels, right? Remember, get better sleep, eat right, do a little exercise. These things actually matter far more than these other things. And let's take this new technology around what the wisdom of timeless things told us and bring it to the forefront by doing what you're doing, which is I don't want to say the word manufacture. You're cultivating these amazing compounds that are doing such good things in the body. So I have so many more questions, but we could go on forever on this, but I love what you're doing, Alex. I think this is going to be really, really amazing. And I really hope that the access becomes something that we're going to be talking about next time.
Yeah. Thank you, Josh. Yeah. And just to emphasize the point, it's, this is a listening exercise, right? I want to hear from other patients. And so, I don't just want to put you on an email list so I can send stuff to you. I want to hear your stories. Because at our core, we're a patient solutions company. And so having that dialogue is truly informative of kind of like where we take things, how do we prioritize them. And, Josh, you kind of previewed it as there are things that can be done today, right? I don't want somebody sitting there idly saying, hey, well, what can I do? Let me wait for it. Do a dietary fiber audit on yourself, like actually pay attention to those labels, quantify it. 95% of us are not at our dietary fiber goal, which is like 30 grams a day. 95% of Americans are not at that. It may be a slight ick factor, but you know what? Look, get to know your poop. It's literally like your bowel movements are a massive, ever-present diagnostic for your current state of being. Get to know the Bristol Stool Form Scale so that you can quantify what number you are every day, and then cultivate the awareness on how you feel associated with where your bowel movement is. I'll tell you what, you're going to say like, when I'm like a 4, those are pretty good days versus when I'm at the opposite ends of the spectrum. And then you can also start to exercise discernment around diet, around the stress, around the sleep, and start to see how these things all stack on. And so it's a very powerful diagnostic opportunity that you can use to self-regulate and self-optimize. So thanks for having me, Josh, and I look forward to
I love it. This is a good conversation. It's in my daily dozen is bowel movements. It's like talking to people about the things they could do for, I look at the scale, just remember poop snakes. Like if you're not pooping snakes at least once a day, we're not in good place. We got to get over the fact that poop is like a bad thing to talk about. It's like, if you're not detoxifying and that thing doesn't look right, nothing else is going to work right. So, Alex, this was amazing. Thank you so much, my friend. I know that we're going to be instantly friends, and we'll be talking about this more and more.
Wonderful.
All right, everybody. This was an amazing little chat we had. Treat your gut right. Everything else will work well. Stay well. Thanks for joining me today on Beyond the Pills. If our mission to de-prescribe 10 million unnecessary medications resonates with you, share this episode, subscribe, and leave a review. Whether you're a practitioner or someone ready to reclaim your health, visit rx2wellness.com for free resources to begin your journey. Together, let's go beyond the pills and co-create a world of vibrant health and true healing. Until next time, live better and stay well.